Good afternoon, everyone. Thank you. And thank you all for joining us for today's Spotlight Forum, Back to School, Navigating Vaccine Uncertainty in Trump's America. And I want to give a special thank you to our panelists for being here. Together, we will shine a light on the importance of the CDC, the Advisory Committee on Immunization Practices, or ACIP, and on experts that inform vaccine availability in America, as well as parents and educators and nurses. We are in what some would call dark times in our history as it pertains to our nation's public health. When the president nominated RFK Jr. to be the Secretary of Health and Human Services, my colleagues and I sounded the alarm. We warned of the chaos and confusion that he would bring, and of the conspiracy theories he would spread. We told the world he would make America sicker. But our warnings were ignored. He was confirmed with the promise that he would leave the Advisory Committee on Immunization Practices untouched. Yet he fired all the sitting members of the committee and installed extremists in their place. He's done so much damage in a short amount of time that 9 former CDC directors have argued he's, quote, endangering every American's health. Over 1,000 current and former HHS staff have called on him to be fired. And under his watch, we've had 37 different measles outbreaks, a total of 1,454 confirmed cases, and the majority of those in children and teens, and 3 deaths, all from an illness that was effectively eradicated thanks to safe, effective vaccines. Now Americans are left wondering how to keep themselves and their loved ones protected from vaccine-preventable illnesses, a concern that has come to a head as our nation's children go back to school. Just last week, Secretary Kennedy came before the Senate and claimed that he has done nothing to restrict access to vaccinations like the COVID-19 shot. But by undermining the ACIP and CDC leadership, he injected chaos into the health system, restricting what vaccines are available at what pharmacies. He's created barriers, intentionally or not, that limit vaccine choice. States are now left to their own devices. And the health of students is now entirely dependent on their zip code. Florida's Surgeon General announced his intention to end all vaccine mandates, while California, Oregon, and Washington will create their own vaccine alliance to protect the health of their communities. My office has gotten numerous calls from Delawareans who have been denied COVID-19 vaccines. And the state of Delaware is now planning to join a coalition of our neighboring states to protect access to vaccinations for families on the East Coast. If, God forbid, Florida has a new wave of COVID-19, a new measles outbreak, or even a resurgence of polio, will RFK change course? Will it be too late? How will neighboring states be able to protect their communities with patchwork guidance and an anti-vax conspiracy theorist leading the charge? We have today before us former ACIP members, pediatricians, parents, a nurse, who will talk with us about what this means to American families, what this mayhem means for our students and their teachers, and how we can find a path forward in this madness. Now it is my honor to introduce today's panel. Joining us today is Dr. Helen Chu, a former member of ACIP and a current physician and professor of medicine, allergy, and infectious diseases at the University of Washington. Dr. Bonnie Maldonado, another former member of ACIP and a current professor and chief of the Division of Infectious Diseases in the Department of Pediatrics at Stanford Medicine. Dr. James Campbell, a pediatrician and professor of pediatrics at the University of Maryland School of Medicine. Denise Buffin, a board-certified school nurse who works for the Brandywine School District in my home state of Delaware and the school district where my 2 children graduated from the high school there and went to grade school and middle school as well. And Dr. Jean Nguyen, a stay-at-home mother of 3 young children who can speak personally to the impacts of these changes. I want to thank you all for being here. I want to also acknowledge for the members of the ACIP, we talked about the fact that before this year, probably no one even knew you existed. I mean, we didn't. But you have been behind the scenes heroes, bringing your expertise and your talent and your time to make sure that not only our country, but the world is safer. And so I want to pay special tribute to you. Thank you to the pediatricians. Thank you to the nurses. Thank you to the doctors and the community members and the parents like myself. And I want to also thank my staff and my team, particularly under the leadership of Dr. Amber Ray, who has worked tirelessly on this issue and even brought it to my attention because I didn't even realize this was happening at first, but this was one of the first things that we addressed when we questioned Secretary Kennedy. You know, it was shocking enough that he didn't know the difference between Medicare and Medicaid. But the fact that this is having an impact on everybody, I want to thank Amber for her leadership as well. Thank you, Dr. Amber Ray. And now, speaking of doctors, it is my honor to turn it over for her comments. Dr. Chu, for your remarks. Thank you.
Thank you so much, and thank you for inviting me to speak today. So Senator Blunt Rochester, thank you for convening today's important forum and inviting me to participate. My name is Helen Chu. I am an infectious disease doctor, scientist, and researcher, and have had a career that's focused on studying respiratory viruses and vaccines. And until this June, I was a voting member of the ACIP. I'm here today representing the Infectious Disease Society of America. So for over 6 decades, ACIP has conducted careful reviews of vaccines, both before and after rollout. ACIP ensures that the vaccines are safe, that they work as intended, and that they're available for the people who need them. Clinicians rely on ACIP recommendations to provide guidance to patients, and individuals use them to make evidence-based decisions for themselves and their families. Importantly, as part of the Affordable Care Act, ACIP recommendations are the basis for health insurance coverage of vaccines, which is what makes vaccines affordable for millions of Americans. ACIP recommendations also guide the vaccines that are available through the Vaccines for Children program, which is a program that provides vaccines for uninsured children in the US and covers approximately half of the children in the United States. Until recently, ACIP was comprised of vaccine experts who were nominated through an open process and extensively vetted for conflicts of interest. The process to become a voting member is years long. It involves a review of all of our actual or perceived conflicts. It is correct that some members have been funded to do research by pharmaceutical companies prior to their ACIP term, but that's precisely the type of expertise that is needed to be able to understand the trials, to interpret the data, and to know what to do with the information coming from the studies that have been done. Every year while we are on the committee, we disclose any new or ongoing conflicts. These are carefully reviewed by the Secretariat of ACIP. And in the case that we do have conflicts, we recuse ourselves from votes or working groups related to these conflicts. ACIP recommended vaccines have saved millions of lives. The abrupt dismissal of ACIP members, the appointment of new members who lack relevant expertise in vaccines or infectious diseases, and the deliberations that we saw at the last meeting that really run counter to most scientific data have left many people feeling confused and bewildered and unable to trust the recommendations from the ACIP. The loss of several CDC leaders, and the FDA decision to only license the COVID-19 vaccine for older individuals and others with health conditions really contradicts scientific evidence. This will prevent millions of Americans from being able to exercise their choice to receive a vaccine. Healthy adults can die of COVID. They can also spread the disease to younger and older individuals who are more vulnerable, and they can get long COVID. So we know that vaccines prevent long COVID. Limiting access to vaccines may needlessly increase the risk of long-term disability in healthy adults. We are now just weeks away from respiratory virus season, and we're really running out of time to vaccinate the people at risk because of the confusion about which vaccines are available, who is eligible to receive them, and whether insurance will cover them. Pharmacies have been a top place where Americans choose to get their vaccines, and FDA's decision will greatly restrict pharmacists' abilities to provide the vaccines in many states. This will lead to overall lower vaccine uptake, not just for COVID, but for many of the vaccines that you get at the same time as your COVID vaccines, like your flu vaccine and your RSV vaccine. This then leads to more illness, more missed days of school and work, more hospitalizations, and more deaths. When we have hospital overcrowding during outbreaks, this compromises our ability to provide care for everything from heart attacks to car accidents, just like during the height of the COVID-19 pandemic. Except this time, the problem will be induced by our own leaders' missteps. So where do we go from here? I am proud that medical societies are stepping up to try to fill the scientific void by releasing evidence-based recommendations for the fall respiratory season. IDSA endorses the recommendations made by the American Academy of Pediatrics and the American College of Obstetrics and Gynecology, and we will be releasing our own recommendations for immunocompromised patients shortly. States are now stepping in to fill this void. They're creating their own vaccine advisory panels. But fundamentally, what this creates is a patchwork approach, where people living in one state have access to vaccines, while others living in other states do not have access, and diseases don't stay within state borders. Finally, I want to note that many medical and scientific societies, individuals on advisory committees, and CDC experts have tried repeatedly to work with Secretary Kennedy to answer his questions about vaccines with objective data and to find common ground with his agenda. He has shown an unwillingness to engage and a disregard for science. This is why several professional societies, public health organizations, and patient advocacy groups are now calling for his resignation. And we hope that our U.S. senators will stand with us in defense of our nation's health. Thank you.
Thank you, Dr. Chu. Next, we'll hear from Dr. Maldonado.
Good afternoon, Senator Blunt Rochester. Thank you for holding today's event on this critical topic and inviting me to participate. I'm Bonnie Maldonado, a pediatric infectious disease physician and former voting member of the CDC's Advisory Committee on Immunization Practices, the ACIP. My research has focused on vaccine epidemiology and development, and I led the COVID-19 response at my institution and for the American Academy of Pediatrics. I am here today representing the Infectious Diseases Society of America. The recent upheaval of ACIP and its decision-making processes threaten the health of America's children. In June, Secretary Kennedy bypassed ACIP and unilaterally announced that COVID-19 vaccines would no longer be recommended for healthy children or pregnant women. Already, children who rely on the Federal Vaccines for Children program, VFC, have been unable to access COVID vaccines, and pregnant women have been turned away at pharmacies because of these changes. ACIP also votes on the inclusion of vaccines in VFC, and roughly 50% of children in the U.S. are only eligible for all vaccines through the VFC program. The FDA's recent decision to license the updated COVID vaccine for only older adults and certain high-risk groups will further significantly restrict vaccine access. These decisions directly contradict overwhelming scientific evidence indicating that COVID vaccines are our best defense against serious illness, hospitalization, and death, including among young children. Infants under 6 months of age are hospitalized with COVID at the same rate as adults in their late 60s, a group we all agree should be vaccinated. These infants could be protected if their mothers are vaccinated during pregnancy. Moreover, 70% of children hospitalized with COVID have no underlying health conditions. Some argue that children do not need to be vaccinated for COVID because it does not kill children. That is false. While fewer children die from COVID compared to older adults, preventable child deaths are unacceptable. Looking beyond COVID, I am deeply concerned about ACIP's agenda for its upcoming September meeting, which includes longstanding recommendations for measles, mumps, rubella, varicella, and hepatitis B, as well as RSV prevention. These vaccines are among the greatest public health successes of the last century. Given the lack of expertise currently on ACIP, many physicians are deeply concerned about the potential ramifications of this meeting. Combining vaccines for measles, mumps, rubella, and varicella have been extraordinarily successful in providing more widespread protection. The spread of misinformation about the measles vaccine promoted by Secretary Kennedy has been a key factor, leading more parents to forego vaccination for their children. This year's measles outbreak in the southwestern United States and declining vaccination rates have led to the highest number of measles cases in the United States since 1992. At the June ACIP meeting, Chair Dr. Martin Kulldorff questioned the utility of the 1991 ACIP recommendation that all infants receive the hepatitis B vaccine within 24 hours of birth. Vaccination at birth is the most effective strategy to prevent chronic hepatitis B, which in babies can lead to liver cancer. Before the universal hepatitis B infant vaccine recommendation, about 18,000 children in the U.S. were infected every year before they reached the age of 10. Hepatitis B rates in U.S. children are now extremely low, almost non-existent, as a result of this program. It is very concerning as well that ACIP intends to review its recently approved recommendation for monoclonal antibodies to protect infants from RSV, a virus that is the most common cause of hospitalization among infants under 2 years of age in this country. These have been found to be highly effective at preventing RSV hospitalizations among infants. Reconsidering the use of this critical intervention threatens to undermine parents' confidence and deny protection to vulnerable infants and children. The upheaval of ACIP is exacerbated by broader attacks on public health, culminating most recently in the resignation of several CDC leaders, world-renowned experts in their fields whose knowledge cannot easily be replaced. Mass layoffs at CDC and reductions in support for public health partners across the country all erode our national capacity to protect children. Without trusted experts and evidence-based vaccine information, we risk resurgence of vaccine-preventable diseases that we thought we had defeated. The current trajectory for vaccine policy and public health overall is unsustainable. Turning away from vaccines is reckless, irresponsible, and will cost children their health and their lives. We must maintain vaccination coverage, access, and uptake to protect the health of all children, including those too young to be immunized or who are immunocompromised. We must act now. I urge Congress to defend the integrity of ACIP and public institutions, restore evidence-based vaccine policymaking, and safeguard access to life-saving vaccines for every child. Our children deserve science, trust, and compassion, not chaos and misinformation. Thank you.
Thank you, Doctor. And next we'll hear from Dr. Campbell.
All right, thank you, Senator Blunt Rochester, for holding this forum and for inviting me to participate. My name is James Campbell. I'm a practicing pediatric infectious disease specialist at the University of Maryland School of Medicine in Baltimore, and I'm the vice chair of the American Academy of Pediatrics Committee on Infectious Diseases, also known as the Red Book Committee. As you probably all know, vaccines are an American success story and have been crucial to ensure that children grow into healthy adults. Unfortunately, access to vaccines on the recommended childhood and adult vaccine schedules is under threat. Actions taken by HHS, CDC, and the FDA have already put access to several vaccines in jeopardy for millions of Americans. As a pediatrician, I know these actions are creating confusion for doctors and parents alike and will lead to more children contracting preventable illnesses. I'm not going to go into the details that Dr. Chu and Dr. Maldonado have already explained, but I do want to echo the Academy's concern about Secretary Kennedy's decision to unilaterally change the recommendations on COVID-19 vaccines, removing universal recommendations for healthy children and for pregnant women without providing any evidence underlying that decision. The recent FDA decision to remove the emergency use authorization for Pfizer's COVID vaccine for children under age 5 and to limit the use of the Moderna vaccine to only infants and children with at least one underlying medical condition will also make it harder for the pediatric population to access this vaccine. These concerning actions follow the Secretary's dismantling of the CDC's ACIP, as you've heard. In an unprecedented move, all 17 voting members were replaced, and just 2 days with 7 new members, many of whom lack expertise. The strength of the ACIP was found in its multidisciplinary expertise, in its insulation from political influence, in its adherence to transparent, deliberative process. Unfortunately, this is not how ACIP is currently functioning. In addition, the new ACIP members voted to stop recommending influenza vaccines that contain thimerosal, even though decades of studies have shown these vaccines to be safe and effective. Breaking with standard practice, the new members did not allow the work groups to consider this issue before the vote and did not solicit any input from the CDC prior to voting on that removal of thimerosal. These actions betray the longstanding, detailed, and deliberative protocols followed at ACIP meetings since it began in 1964, and leave us concerned about transparency and how discussions on other recommended vaccines are going to occur in the future. The AAP was founded in 1930. The AAP has been a leading voice in creating evidence-based vaccine recommendations and published annual immunization recommendations well before the creation of ACIP in '64. For decades, the AAP now has aligned itself in those schedules with the ACIP. However, based on the votes of the last ACIP meeting and the action taken by Secretary Kennedy, it became apparent that we could not remain aligned, especially with the respiratory virus season upon us. Families deserve clear, evidence-based guidance from a trusted source on childhood immunizations. As such, our Committee on Infectious Diseases met this summer and extensively reviewed the most recent data available for COVID-19, RSV, and influenza. And I encourage everyone, you can all review our recommended schedule in full, but I want to highlight some of the things on AAP's schedule that diverge now from the CDC schedule related to those vaccines. For COVID-19, it is absolutely clear that infants and children 6 months through 23 months of age are at the highest risk for severe COVID illness and hospitalization. Given this, the AAP recommends COVID vaccine for this age group to help protect them against serious illness. The AAP also recommends COVID vaccine for children in certain high-risk groups and for those whose families want to get the vaccine for them. For influenza, the AAP we recommend annual flu vaccines for all children starting at age 6 months unless they have a medical reason not to be immunized, and that they can receive any licensed influenza vaccine product appropriate for age and health, including those that contain thimerosal. To alleviate confusion for clinicians, the AAP published a policy statement and corresponding schedule that spells out the recommendations and how we determine them. For parents who simply want to make sure that their children are healthy, the incredible volume of false rumors and misinformation being spread online is making it more difficult to know whom to trust. Fortunately, pediatricians have always had conversations with parents and their families about immunizations, will continue to be the most trusted source of information for parents about the health of their children. To help with these conversations, the AAP will continue to share accurate information about immunizations and child health, including on social media, websites, and in the conversations that pediatricians have with families in their practices. We need to continue doing all we can to ensure access to vaccines. Finally, it's important to remember that maintaining access to vaccines is a nonpartisan position. Polls show that the majority of Americans support access to vaccines. It's important to remember that most parents, almost all parents, still vaccinate their children and do not want to lose access to vaccines that keep their children and their families healthy. Thank you for allowing me to participate.
Thank you, Doctor. And next we will hear from Ms. Buffin.
Hi, thank you, Senator Blunt Rochester, for giving me the opportunity to speak with you today in this distinguished panel. I appreciate it. My name is Denise Buffin. I have been a school nurse for almost 30 years in Wilmington, Delaware, and I am also the president of the Delaware School Nurse Association. As a school nurse, I see every day how vaccines protect the children in my care and how they protect communities across America. But what happens when the very experts who guide our national vaccine policy are dismissed or silenced? Today, I want to share how the firing of CDC experts fuels public distrust, disrupts our health system, and creates confusion in schools, including my home state of Delaware. CDC vaccine experts are the backbone of our national immunization system. They track outbreaks, recommend immunization schedules, provide schools with timely guidance, and push back against misinformation. Without them, the infrastructure that keeps our system science-based begins to fracture. When experts are removed, families and schools face delays in outbreak guidance. Misinformation spreads quickly, filling the gap left by trusted voices. And policy instability makes people question whether recommendations are based on science or politics. In Delaware, vaccine requirements remain unchanged. Specific vaccines are required for school entry. Medical exemptions must be approved by the Delaware Division of Public Health and signed by a provider. Religious exemptions require a notarized affidavit, and personal or philosophical objections are not valid. But national confusion is spilling into our schools. Families are asking, are vaccines now optional? Can we claim a personal exemption? Have Delaware's rules changed? The answer is no. Delaware law has not changed. Yet school nurses are the ones answering the calls, returning incorrect forms and trying to prevent students from being excluded. And while Delaware has 0 measles cases today, cases are rising nationally, making clear, consistent communication essential. This confusion affects everyone. For school nurses, time spent clarifying vaccine rules takes away from managing chronic conditions, doing screenings, and supporting mental health. It increases stress and burnout, strains relationships with families, and undermines our professional credibility when federal and state messaging conflict. It also adds an emotional toll, especially when we're correcting neighbors and friends in our own communities. For parents, the result is frustration when forms are rejected or when online claims don't match state law. For students, it means the risk of preventable illness, school exclusion, and missed learning. And for communities, outbreaks don't stay in school, they spread, threatening public health and straining resources. To keep kids healthy and in class, we need consistent federal and state messaging that school vaccine rules are set at the state level, stable, science-based communication that builds trust and prevents unnecessary exclusion. School nurses will continue to do this work, but we need aligned public health leadership backing us up. In closing, the firing of CDC vaccine experts creates confusion and mistrust that lands directly at our school doors. Delaware's requirements have not changed, but families, students, and school nurses are left sorting through mixed messages. Our children deserve stability, they deserve protection, and they deserve the chance to learn without disruption of preventable illness. Clear, science-based leadership is what keeps kids in class and communities healthy. Thank you.
Thank you so much for sharing your comments and remarks. And we will lastly hear from our witness, Ms. Nguyen. And then we also have joining us Senator Richard Blumenthal from the great state of Connecticut. So once we have your last testimony, I'll ask questions, and Senator, we'll turn to you.
Good afternoon. Thank you, Senator Blunt Rochester, for holding this forum. My name is Jean Nguyen, and I'm a proud member of Moms Rising. I live in Olney, Maryland, and I have 3 incredible children, ages 3, 6, and 8. I appreciate the opportunity today to come and share my concerns about how changes to federal vaccine policy will impede access and raise costs for families like my own. I brought a picture today because I am here to stand up for science, because science has stood up for me. My son Andrew was born prematurely, weighing 1 pound and 13 ounces. That meant that his antibodies were lower and that his lungs were underdeveloped and prone to infection. We depended on our medical team to give us sound scientific advice. To keep him safe, and including to make sure that we're fully vaccinated and updating any boosters that were out of date. Today, by the grace of God and science, very strong science, Andrew is here. He is a happy first grader who loves reading, playing soccer with his dad, searching for bugs. Given how much that, very important things, yeah. Given how much science has given me as a mom, I am horrified and very perplexed by the many ways that the Health and Human Services Secretary, Robert F. Kennedy Jr., has broken with evidence-based practice, putting families' health at risk. I know too well how science and how policies can have life or death consequences. I can tell you that families have serious concerns right now. To start, families are confused and alarmed that the Advisory Committee on Immunization Practices recommendations for COVID vaccinations are no longer aligned with science. For example, the CDC no longer recommends COVID vaccination during pregnancy, despite overwhelming evidence that it is safe and helps to prevent premature birth and adverse outcomes such as death. Now, rather than recommending that children 6 months and older receive COVID vaccination, the ACIP is recommending that only those with underlying conditions or adults 65 or older receive it. Families like mine are asking, who decides what qualifies as an underlying condition? Will families have to rely on doctors to prescribe the COVID vaccine for their children if they have underlying conditions? Or for children who their underlying conditions have not yet been discovered. My son, for instance, has not formally been diagnosed with asthma, but he has asthma-like symptoms that make avoiding infection especially important. Who decides if he can access the vaccines he needs to stay healthy? If families need prescriptions for the COVID vaccine, that introduces so many new hurdles. Right now, getting back to school vaccines is as easy as swinging by a pharmacy or a walk-in clinic at our own convenience. Getting a prescription requires that you have a primary care provider, and we know that there is a shortage. Plus, it requires time off from work, as well as transportation for that appointment. Aren't working families already juggling enough? That's not to mention the cost. If ACIP no longer recommends the vaccine, insurance might not cover it. I've read that vaccines can cost as much as $100 to $200 out of pocket per vaccine. If you have 3 kids, like myself, that means back-to-school COVID vaccines would cost up to $600 and another $400 for 2 parents. Working families are already feeling the strain of rising costs of food, housing, utilities, and other basics. I also read a CBS article that more than half Americans don't have enough savings to cover an unexpected $1,000 expense. Vaccines shouldn't be a luxury accessible only to those who could pay for them. I'm lucky. I live in Maryland, where Governor Wes Moore has signed legislation that requires insurers to cover ACIP-recommended COVID vaccinations that were in place in December of last year. But what about other families in other states? That creates such health inequity across the U.S. Most of all, I am terrified that the confusion RFK Jr. is causing will lead fewer children and families to get vaccinated. That will lower overall herd immunity and fuel the spread of disease because diseases don't know state lines or political affiliations or how much money you have in the bank. I've even read that ACIP may recommend changes to the regular childhood vaccination schedule. I don't know anyone in my generation who has had polio, rubella, or the measles. Will my children be able to stay the same? To prepare for this forum, I sent an informal survey to families in my community about their concerns. My friends and neighbors shared heartbreaking fears about their loved ones who are undergoing chemotherapy, for themselves who may have immunocompromised conditions, for being a part of the sandwich generation that are caring for small children as well as aging adults, and just being unable to manage the rising costs. One friend summed it up perfectly. She said, as a parent, my time is limited. I need to be able to trust that the agencies tasked with protecting our public health are based in science and expert opinion. That's what parents want most of all, to be able to trust that our nation's policies are guided by science, not politics. We are counting on the country's leaders to repair the trust and protect vaccine access. Thank you again for today.
Thank you so much, Ms. Nguyen, for your testimony. And I think you were the perfect person to round out the testimony, bringing it right back to the faces and the pictures of children, especially as we talk about back to school, to talk about from the perspective of families who are right now trying to make ends meet and don't need another burden on their pocketbooks. I also carry a picture with me, which is my granddaughter. And I think for all of us here, not only is this professional, but it's personal. We want to see our kids healthy. We want to see our grandchildren healthy. We want to see our grandparents healthy and alive as well. And so thank you so much for your testimony and all of the incredible testimony. We've also been joined by Senator Amy Klobuchar, who will be speaking as well in a minute. Just want to check your time. Are you okay? Yeah. If I do my 5. So I will start with 5 minutes of questioning, and then we'll turn it to Senator Blumenthal and then Senator Klobuchar. Again, thank you for all of your testimony. One of the other things that you mentioned, Ms. Nguyen, was the fact that for many people, we've never even seen some of these diseases. I had an aunt who suffered through polio, but I had the chicken pox. There are a lot of parents that don't even know what to look for and what to expect, and even doctors who might not have experienced this before. And so this is a huge shift for us. And I want to start with Nurse Buffin with my first question. You've been a school nurse for over 30 years, and in your job, you get to see how important vaccines are for keeping students healthy while they get an education. Yet Florida Surgeon General, as I said, has linked vaccine requirements to slavery and is trying to eliminate all requirements. What impact will this have on children, especially those like Andrew who may be immunocompromised?
Thank you for that question.
Is your mic on?
There we go. Thank you for that question. I would like to reiterate what Ms. Nguyen said. In public school, every child is entitled to a free education. So we get everybody. We get all children, no matter what their circumstances, no matter their health status. So we do have children who are immune compromised. We do have very healthy children too. Fortunately, that is the majority. However, because of all the questioning, I'm worried that immunization rates will fall. Incidences like the measles outbreak will spread throughout the whole country and not just be limited to the certain areas that it's been. I worry about chickenpox. I missed almost a month of work because my kids had it, one after the other. My kids, fortunately, have never seen the chickenpox in anybody else. They don't remember having it themselves. So they may not recognize it in their own children. Kids who are affected by infectious disease that is preventable by vaccine, safely preventable by vaccine, will miss school, they'll miss their education, they'll miss their social life with their friends. So, thank you.
Dr. Chu, as one of the former members of ACIP yourself, can you please describe for everyone what it really takes or took to become a part of the committee? I think people don't understand who's on it, what the qualifications are, what it took to actually become a member of the committee.
Sure, thank you for that question. I can speak for myself, and I'm sure Dr. Maldonado also has her process. So for me, I have been studying respiratory viruses like RSV, flu, and also COVID for 15 years. And as part of that, I joined what's called a work group about 3-4 years ago, which means that we meet for 2 hours every few weeks to review all of the data in detail. After several years of being on the work groups and helping the ACIP make decisions, I was asked to apply for membership to the voting committee, which is this panel of 17 members that vote. That took 2 years, so it was a very, very long process. We apply, we submit letters of recommendation. We go through all of the interactions we've had with pharmaceutical companies, all of our conflicts. As part of the expectation of joining ACIP, many of us then remove ourselves from those interactions because we know that that is a conflict and we cannot have that conflict when we are on ACIP. So that 2-year process then leads to appointment to membership to ACIP. And then every single year, we again go through the process of reviewing any potential conflict to make sure that we don't have anything that could potentially influence our ability to make an unbiased, science-based decision.
Thank you so much. As you were talking, I was thinking about the fact that 17 members were fired and immediately 8 people. Now, you just mentioned years and years, not only of education and training, but also of service before you were a member. Dr. Maldonado, I'm going to ask you that question again after I yield some time to my colleagues, because I have more questions here, but I want to respect their time. And so I'm going to actually yield to you, Senator Blumenthal, for your 5 minutes of questions.
This topic is of such immense importance to the parents and all the people of America as we go back to school. And I am struck by the decline in vaccination rates, which obviously predated this administration, but the public statements and the appointments of this administration will only accelerate that really unfortunate trend. And more specifically, the appointments to replace the 2 of you and 17 in total members of the ISAP. I would characterize them as unqualified and opponents of vaccination. Am I wrong in that characterization, Dr. Chu and Dr. Maldonado?
They certainly have preformed opinions.
Yeah, I know most of the 7 people who are on the panel, and a couple of them pretty well, and they have had a very similar script over the years of denying obvious science, yes.
I questioned one of them, Dr. Robert Malone. I don't know whether you're familiar with the tweets that he posted, which are very threatening in my view. He thought it was a figment of my imagination, I think. But I'm deeply disturbed because the threats to public health workers, physical threats, have become more numerous and more serious. Are you finding among your colleagues in the public health community that there is a fear of those physical threats as exemplified by the August 8th attack on the CDC headquarters by a gunman who fired 200 shots and killed a police officer?
So Senator Blumenthal, I've been a vaccine researcher for my entire career, over 30 years. And I can tell you that the others may have the same feelings. I'm a card-carrying member of the American Academy of Pediatrics and have worked closely with them. And in all that time, we have faced vaccine threats from anti-vax people over time. They have been low level, but we are very careful. I have to say that those threats have only been exacerbated in the last year or so. And I actually chaired a task force on the safety and well-being of the pediatric workforce for the American Academy of Pediatrics. We just completed that report and posted it to the Academy because our pediatricians, our general pediatricians, are fearing attacks, personal, physical attacks, as well as just feeling uncomfortable with some of these subjects because of the misinformation that's spreading.
Dr. Chu?
I can say that I work very closely with CDC colleagues on a number of studies, and there is just a sense of loss of morale in the workforce. These are people who are public servants. They have dedicated their lives to doing work for the public good, and they feel like they're being attacked from all sides. And most importantly, they feel like there is a vacuum of support from leadership.
And have you been in contact with your former colleagues at the CDC? And would you say that these kinds of posts from a member of the Advisory Committee on Immunization Policy, an official body of the CDC and our United States government, have an impact on their morale? Dr. Maldonado.
Yeah, so the executive secretary of the ACIP, and she and I trained at the same time at CDC, and I've known her for all those years, and she has just stepped down, actually. What's today? Tomorrow will be her, 2 days from now, will be her last day after serving her entire career as a CDC leader. And many of these people have said that they are just not able to function in this role anymore. And you've heard some of their public statements, I'm sure. But they are very disheartened, not because of their own personal work, because they continue to work very hard, but because they are worried about the safety and the ability to do this kind of work, as well as to protect the American public, which is our really their sworn duty.
Dr. Campbell, pediatricians. You're a pediatrician. You represent the American Academy of Pediatrics. How are they feeling about some of these controversial threats and potential intimidation of the work they are doing to keep children safe? And really, they bear the burden of advising parents. The Advisory Committee on Immunization Policy advises the Secretary of Health and Human Services, or the CDC director, but pediatricians are on the ground advising parents every day.
Absolutely. Thank you, Senator. Yes, so we've felt the impetus that we needed to now diverge from the federal guidelines for vaccine recommendations because they're not being deliberated appropriately and they're not using science to make those recommendations. So for 30 years, the AAP 30 years ago went to ACIP and said, hey, we've got multiple professional societies and groups in the United States making recommendations. We should all get together and have consensus. And since 1995, we, members of the AAP who are vaccine experts, sit on all the work groups. We have people on ACIP. So we are have been trusted partners. And the reason why we could have a consensus is because the AAP and pediatricians were providing a lot of expert advice to ACIP. But now we're disinvited. We're really not at the table anymore. And the ACIP is making decisions not based on what anybody who would read the data, anyone else would make those decisions. So we've taken it back, the AAP, and we're trusted, 67,000 members of the AAP, essentially all providers of pediatric care in the United States. And so they trust, what our recommendations would be. I think there's somewhat of a misconception about who that is. I'm a pediatrician and an expert in vaccines and infectious diseases. I don't work for the AAP. I'm a practicing pediatrician. I spend my nights and weekends trying to help to write these recommendations. Other pediatricians expect people like me to do that. I expect other pediatricians who are experts in hypertension to help me with kids with high blood pressure, with kids ones who know about jaundice to help me with how do I care for them. So we're here for the other pediatricians and pediatric providers, and we take that on because children don't have anyone else to advocate for them other than parents and us.
Well, I thank you for your advocacy, and I thank all of you for being here today. I wish this were a formal hearing. It deserves to be a formal hearing in light of the expertise and the life's work that you bring to us. Our Republican colleagues simply don't want to hear of it. We had a hearing yesterday in the Permanent Subcommittee on Investigation about the quote-unquote corruption of science. What you've just described to me is the corruption of science. Pediatricians having to go outside the guidelines from their own government because it has demonstrated such disrespect for science. And so I want to thank all of you for your respecting and upholding science and healthcare. Thank you.
Thank you, Senator. And I will now turn it to Senator Amy Klobuchar for her questions.
Well, thank you. And thank you, Senator Blunt Rochester, for convening this important briefing, and thanks to our witnesses. I'm just was stunned by those numbers up there, right behind Senator Hirono, the 30, that's just 30 years where you have vaccines preventing 500 million cases of illness, 32 million hospitalizations, 1.1 million deaths. And you think of those 500 million, it's a whole lot of people you know in your own families. We have always been economically on the leading edge when it comes to disease, when it comes to medical research, innovation. Minnesota is home to the Mayo Clinic. Minnesota is home to the development of the first single oral dose of polio vaccine, which I actually didn't know until you had this hearing. New fact I'll be like bringing out there all the time, which actually made it possible for our country to start that large and successful vaccination campaign. And yet 70 years after that vaccine was developed, we have a Health and Human Services Secretary who, instead of working with American scientists and researchers to save lives, is threatening the health of American kids. So I truly appreciate that this is done around the beginning of school. And so in that spirit, I'll start with you, Ms. Bradley Buffin. My mom taught second grade till she was 70, so I am well aware of the importance of the school nurse. And the last thing that their parents need during the busy back-to-school season is to be confused about whether they should have vaccines, especially those that are starting and you fill out the forms and they get all this contrary information from someone who does and should know better. So as a school nurse, what effect have the administration's chaotic, confusing, and conflicting messages about safe, effective vaccines had on parents and kids and students' readiness?
Thank you for your question, Senator Klobuchar. It's really nice to meet you. I am finding that my parents are confused about the importance of vaccines. They are questioning why they need to have these vaccines. And I will say, well, one, they're mandated by law in Delaware that they are required to have these vaccines. But then they want to pursue that further, and I'm happy to do that. I'm happy to talk with them about vaccines and do some education. I have written material that I keep in my office for them. But it does take time to do that, and that is time that's taken away from me taking care of our kids who have chronic illnesses and doing their vision and hearing screening and making sure that they're well and safe to stay in school and learn. So it's just creating confusion. It's creating a little bit of conflict between a relationship that I should have with parents that is safe and opening. And for some parents, it's a little bit conflicting.
Exactly. Thank you. Dr. Chu, we have, I think, 37,000 people expected to be diagnosed with cancer in 2025, and there are currently 2 types of FDA-approved preventative cancer vaccines. The HPV vaccine protects against 5 types of cancer in women and 4 types of cancer in men. So since the first HPV vaccine was approved in 2026, cervical cancer rates for young women have declined 11% every year. Do we have the potential to eliminate cervical cancer in our lifetimes because of this vaccine? And how has widespread adoption of the HPV vaccine changed cervical and other kinds of cancer rates in the U.S.?
Thank you for that question. That's a really important question. So there are many vaccines that prevent cancer. Hepatitis B vaccine, HPV vaccine are both important vaccines that we give to children. So the HPV vaccine is a remarkable vaccine. It is highly effective. In fact, we now know that you actually don't even need the number of doses that we currently recommend, and there has been a decision internationally to go down to 1 shot of the HPV vaccine. And it is likely that in the future that we will also do that in the United States, and those conversations have already started with the prior ACIP. What we know is that they decrease rates of cancer, and they have really brought down the rates of cervical cancer precipitously in the United States and also importantly globally, where many women go undiagnosed and develop cervical cancer, and that really has a substantial impact on themselves and their families. And we know that that Secretary Kennedy is very much opposed to HPV vaccines. And so I
Thank
don't.
you. I get it. Last, Dr. Maldonado, in July, Secretary Kennedy, who was just mentioned, abruptly canceled over $500 million of vaccine research grants. We know that there are FDA-approved vaccines that have been approved for prostate cancer, bladder cancer, melanoma. Memorial Sloan Kettering Cancer Center has been testing a vaccine on pancreatic cancer, and yet now we've seen these abrupt cancellation of grants. What have this done in terms of research and the direction we were headed? And that will be my last question.
Well, thank you, Senator Klobuchar. That's a wonderful question. As we know, Operation Warp Speed was a success. It worked to help us promote mRNA vaccines. And these were, at the time, really considered to be miraculous in the way they worked. They saved lives. They saved hospitalizations and chronic diseases. And I do know Senator Blumenthal mentioned Mr. Robert Malone, who claims that he was one of the discoverers of mRNA vaccine. He was not. He worked on the vaccine. I know him from conversations we had during the pandemic, and many of the claims that he's made have really, I think, fed into Senator Kennedy, Secretary Kennedy's distrust. But these are really game-changing products that can really affect not just infectious diseases, but cancer and other chronic diseases as well, as you mentioned. And we are stopping this technology at the risk of our own innovation in this country. They're gonna be pursued elsewhere. We're gonna lose time and ability to really start to fight chronic diseases as well as infectious diseases in this country. Because you can't just start and stop industry on a dime. It takes time to build that up. Thank you.
Thank you.
Thank you so much, Senator Klobuchar. And I will now turn it over to Senator Mazie Hirono from Hawaii.
That's awesome. It's the opposite of some of the other committees. It's
I
like,
know exactly
oh,
what you
yeah,
mean.
what the heck. Well, first of all, I want to thank Senator Blunt Rochester for her leadership in calling attention to what is happening to healthcare basically in our country. We are being so-called led by a secretary who has no real medical background, who are making all kinds of suggestions and decisions that is actually taking us backwards, wouldn't you say, in terms of public health. All of the, yeah. So I thank all of you for coming and testifying and calling attention to these very scary times. Now, I was looking at some of the data in Hawaii, and the rate of vaccinations for children is going down. And in fact, the elementary school I attended has the lowest rate of vaccinations. And I'm not sure what is causing that. I know that misinformation and fear about the required vaccinations is a part of it, but I don't know if I don't know that that's enough, you know, for us to really understand what is going on and the danger to our communities for this kind of drop and vaccinations. So I'm just wondering, for example, the state of Hawaii has a prepaid healthcare law that requires our insurance companies to pay for certain kinds of preventive efforts, and that would include vaccinations. And I don't know if if our state law will prevail in terms of who's to pay for these prevention practices, including vaccinations, or whether if Secretary Kennedy's people say we're not going to require these vaccines anymore to be covered by insurance. Do you know what laws would prevail in a situation like that in terms of coverage? Because these are expensive vaccines. It could be over $100 for a polio vaccine, a measles vaccine. Anyone wish to?
Yeah, so I can start, and surely the others can. And as you know, it's a complex series of events. So on the one hand, we have a program for children under 18 and under called the Vaccines for Children program. Any vaccine that is recommended by the ACIP, by the CDC, will automatically, by a vote of the ACIP, has to be covered by these programs. So every child under 18, if they don't have insurance, which will automatically be covered by a VFC. The problem, of course, is if the vaccine gets taken off
Yes.
of recommendation, then nobody may cover that. An insurance company, so far, many insurance companies have said they will continue to cover, but that may change over time. And in fact, there is some pressure now on some of these VFC providers to not fully fund those state programs if they don't go along with the ACIP recommendations. So it's actually, if anything, there are efforts being made now to try to pull away from provision of funding for people who want vaccines, even if they're not recommended.
I think that is exactly what is going to happen. I don't see why we should believe otherwise, because we have a secretary who is basically anti-vaxxer, and he has now eliminated all his advisory people who look to science and evidence for their recommendations, and now we have ideologically people with an ideology who are going to be making these recommendations, and I think that we can fully expect that they are going to impose their anti-vaccine views on the community, which means that not only will children not be protected, also probably seniors, they're going to get to seniors probably, but not only will children not be protected by these requirements, but it's going to make it a lot tougher for families to afford this kind of coverage. So what happens when a child, let's say, who is not vaccinated, gets sick, gets measles? How is that, how are they treated?
So there is really no treatment for measles. There is supportive care. You can give fluids, and maybe if they have pneumonia, which is fairly common.
Measles is highly contagious,
It is
isn't it?
very contagious. But so there's no active treatment. There's only supportive care. But 1 in 1,000 children can die from measles, especially children under 5. 1 in 3,000 children can have neurologic symptoms that actually can be lifelong. And so we don't see that anymore because we don't have measles, but, and we don't see it because we've had 1,400 cases. But if you start to see large outbreaks, it is one of the, if not the most infectious diseases. That and chickenpox are probably the most infectious diseases we know so far.
What about whooping cough?
Whooping cough
Also
is also contagious, and we have been able to control that with vaccination. That vaccine is not as effective, so we need to continue to give that vaccine over time. But that disease also can have its biggest impacts on children under a year of age, and those children can become.
I think that children, because they're exposed in their elementary schools and all of that, this kind of disease, it spreads like wildfire. So how can we contend with all of the decreasing vaccination rates in our country? What can we do to fight back? Anybody? Kind of looking at this side of the panel.
Thank you, Senator Hirono. I'm Dr. Jim Campbell I'm a pediatrician, pediatric infectious disease vaccinologist at the University of Maryland. I mean, the main thing that we can do is to provide accurate information to both providers and the American public, and to undo the misinformation. And misinformation is one thing. This is where people misunderstand what maybe some of the people who are experts would understand. A bigger problem is disinformation, putting out purposefully false information about vaccines. It's very important for people to understand both about the vaccines, their safety and their effectiveness, but also, as we said before, so many of these diseases, we've had such great success with them that both providers, parents, and children, we've not seen these problems for a long time. And so trying to convince people just how bad it is when I've taken care of a teenager who died of hepatitis B because she had 2 liver transplants, but those failed. If she had been vaccinated with a $20 vaccine, she would not have died from that. We just had a child in the hospital with invasive pneumococcal disease who was not vaccinated. This is a toddler with 3 chest tubes and a ventilator, all because he had not been vaccinated. So I see that, but you don't see that, and I think letting people know these things still exist when you're not vaccinated, and how important it is that we keep the vaccination rate up.
Thank you, Doctor.
Thank you, Madam Chair. Thank you for your patience, and to my friend.
We appreciate
my friends over
your
there.
comments,
Mahalo.
and thank you for your questions. And I will now turn to Senator Ben Ray Lujan.
Thank you, Madam Chair, and thank you, Senator Blunt Rochester, for your leadership in bringing us together at such a critical time, such a critical topic that touches everyone across the United States of America. I thank you for your leadership, Senator. You know, recently, as we're all aware, Secretary Kennedy was before the Senate Finance Committee. And I asked him a simple question. Well, I guess I didn't even ask the question. I simply just told him that the American people just wanted the truth. And I was shocked with his response. It was, I don't think so. You just reminded us, Dr. Campbell, why the truth matters. That's misinformation. It could cost someone their life. Getting inaccurate information associated with an illness, a solution, a vaccine, a life-saving, affordable solution. Now, Dr. Campbell, recently the COVID-19 booster was only approved for a small subset of the population. How do these changes keep people from walking into a pharmacy and getting their COVID booster?
Well, pharmacists will typically not provide a vaccine, quote, off-label, meaning if the FDA's indication on the prescribing, on the package insert does not have that age range or that particular person with those risks, then they can't typically get it in a pharmacy. They may be able to get it with a prescription. And pediatricians and other providers are concerned about their liability. We should not be I don't think we as providers should feel like we're in a position we have to worry about being sued for providing life-saving vaccines that are known to be safe and effective. But that is a concern. We get that question at the American Academy of Pediatrics now all the time. Is it okay for me to give COVID vaccines to a child when the FDA has now said that it's not?
I mean, it's doing it in many states, including in New Mexico. People will now need to get a prescription to receive their COVID-19 booster. How might this additional step make it harder to get a vaccine?
I apologize. Having to have a prescription in order to get a COVID vaccination will require that you, one, have a provider. There's a shortage of providers. It means that you would have to take time off work. You would have to have transportation. I apologize. In order to get a prescription, in order to have a vaccination, you would have to, one, have a doctor and have a provider. There's a shortage of doctors and providers. You would have to have transportation, time off from work. There's a lot of different barriers that could be involved with that. Also, you would have to have money because from my research, vaccines off-label could cost anywhere between, for COVID vaccination particularly, could cost anywhere between $100 to $200. I have 3 kids, so if I needed to get my kids back to school vaccinated with a COVID vaccine, that's $600. I share elder care duties with my sister-in-law for an aging member of our family, so getting vaccinated is very important for us as adults as well. For the additional adults in my household, that's additional $400. For the siblings that take care of that adult, that's an additional $100 to $200. The costs add up, and it creates inequity. Vaccines should not, you shouldn't have to have money to be able to get the health care that you need.
And arguably information.
Correct.
Secretary Kennedy's actions to make it harder just to get information.
Oh, absolutely.
Yes.
I know as a parent, one of my if I have a question related to health, or if I have a question related to developmental milestones, amongst the first websites that I go to is the CDC as well as the AAP. As somebody who is also trained as a speech-language pathologist, I oftentimes would work with families and I would use the CDC milestone tracker. I'm concerned now if evidence-based practice and science isn't being used to help drive policy and help drive recommendations, I would be concerned to go to those websites and utilize them for information to guide my decisions, as well as to advise friends and families to do the same.
Appreciate that. And Madam Chair, I have other questions. I'll submit them into the record. The one that I was hoping to bring attention to was the fact that Secretary Kennedy hired this person that was found breaking the law in Maryland, pretending to be a physician. And now this is the person that's going to be at the helm with all of this autism report, if you will. And just the way that this guy was cooking the books out of Maryland, I can't imagine what the United States and the American people can expect to see from this person. Thank you for your leadership.
Thank you so much, Senator. And I will now turn it over to Senator Schiff. As you can see, this is a popular topic because it affects all of our country. And so we're fortunate to have a good representation of senators asking important questions, as well as Marylanders who just joined the room as well. And I will turn it over to you, Senator Schiff from California.
Madam Chair, thank you. Madam Chair, thank you so much for holding this very important hearing. We are all getting calls from our constituents, including a lot of our elected constituents, wanting to know what is the deal. We had a family member go to CVS to get a vaccine and they were turned away. Who can get it now? How can they get it? And what I'm hearing from you is, based on these new recommendations of CDC, not based on science, a lot of people are going to be turned away. And if they can get the vaccine at all, it means they're going to have to pay hundreds of dollars potentially to get it. The fact that you might have a elder member of your family or someone who's immune compromised, you still don't meet the guidelines. I mean, this is literally going to cost people their lives. The broad attack on science is going to cost people their lives, and maybe in no field of health or science is the impact going to be so great as with vaccinations. Dr. Maldonado, I want to thank you for coming all the way out from California, from my old neck of the woods, my alma mater. Let me ask you, as you know, in May, Secretary Kennedy took to Twitter to announce that the CDC had changed its vaccine recommendations in a now infamous 1-minute-long video. In the post, he said, quote, "I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule." That was done without input from CDC's immunizations experts. What was your reaction as a member of the ACIP at the time of the announcement? What was going through your mind when you first learned, and maybe you first learned on social media, I don't know, that the CDC was changing its COVID vaccine recommendations in a way that was not based on science?
Well, Secretary, thank you for that question, Senator Schiff. Secretary Kennedy has a track record. This has been a very long-standing approach that he's had, so I suppose I was shocked but not surprised. But I was also concerned by the fact that he was proud of a recommendation that flew in the face of science and data and facts that we all have worked on and lived through during the pandemic. So we know, for example, that children under 6 months of age have the same death rate and hospitalization rate as people 65 and older. We also know that pregnant women who don't get vaccinated have higher rates of complications from COVID, and can also, vaccination to pregnant women will protect their baby for the first 6 months of life as well. So I don't think that's something to be proud of, and it was very concerning to me.
And what do you think the real-life consequences this will have on pregnant women and on newborns? What's going to result from this change?
Well, so colleagues of mine from Stanford and Baylor wrote a paper that will be published in the next few weeks. We looked at that impact, actually. We saw that recommendation in May, and we took to our computers right away and said, okay, well, we know how this vaccine works. We know how the virus circulates. What is the potential impact of not vaccinating pregnant women on pregnant women themselves and on their babies? And we found in this paper, we projected that there would be thousands of hospitalizations of pregnant women and hundreds, if not thousands, of hospitalizations of babies as well, and possibly deaths as well. So we know what happened during the pandemic, and we know what could happen even today.
So I've heard sentiment expressed from constituents that, hey, if other people don't want to get vaccinated, that's their business.
I want to make sure that I can access a vaccine. But isn't there a consequence also in discouraging vast numbers of the American people from getting vaccinated? Because even if you get yourself vaccinated, you have increased the chances of being exposed to the virus. And the vaccine may only mitigate the effects, but it still may not prevent you from getting long-haul COVID or some other severe consequence. What is the impact of discouraging vast numbers of people from getting vaccinated, even if you yourself get vaccinated?
There's two things. One is we know something called herd or community immunity is very important. It's why we don't have these infections today in the United States and why most people don't know these diseases exist. These viruses have not been eliminated. They're still floating around the world, but we're protected. It may not protect us against infections necessarily, but it will protect us against disease. And those are things that people just don't understand. We need to remind people. There's a lot of other things that people are doing in their busy day. They're worried about how to pay the bills, how to get to work, how to take the kids to school. I have 3 kids. I know how busy you can be, and you need to be reminded. And what Dr. Campbell said about disinformation or misinformation, we need to remind people. And that has not happened, especially with the measles outbreak, where we did not hear from our federal leadership, our public health leadership, that people should consider getting vaccinated. That message did not come across, and people need to be reminded.
Thank you.
Thank you, Senator Schiff. I'm going to turn it now to Senator Ed Markey.
Thank you, Madam Chair. Dr. Chu, as a former member of the Advisory Committee for Immunization Practices, alongside Dr. Maldonado, you've seen firsthand how the Advisory Committee uses data to guide the recommendations so that the public can have confidence, so that vulnerable populations like pregnant women, infants, get the vaccine, for example, through COVID. So what are the greatest concerns for you right now with the undermining of the confidence in the Advisory Committee in terms of parents' trust, especially in the science-based recommendations that historically that panel has been making?
So thank you for that question, Senator Markey. It is a very important question and really is based on trust. So the ACIP has been in place for over 6 decades, and before that there was the American Academy of Pediatrics making recommendations, and all of the processes that have been in place have been science-based. And what you don't see at these public meetings is the hours and hours of decision-making that goes on behind the scenes. All of the data that's reviewed by the CDC scientists and then presented in working groups that we are part of for hours of our days. And we do this as volunteers because we want to provide service to the American public. And we review all of the data, and then we come together at these public meetings 3 times a year to present the data and to discuss it in front of everyone so that it is an open, transparent process. And experts in vaccines and experts in infectious diseases all come together, and they really are people who have been working on this for all of their careers. And so they're able to look at this data to understand what is real, what is an artifact, what is potentially something that shows up early in the data, but that won't show up later. And then to make decisions about the best next steps given the information we have. And I think the really important thing that I've appreciated about being on the ACIP is that you make your decisions based on the best scientific data available, and you make that decision in front of an audience so that everybody can see how those decisions are made and what data is being used. And then after the decision is made, what you do is you monitor that vaccine in real life. You look at how it works once it's rolled out in the population. You make sure that the decision that you made was correct. And if it wasn't correct, if you start seeing things that are adverse events that you did not expect to see, then you change the decision. So I think all of that is really, really important, and it's a very transparent process, and it's an ongoing process, and that has been gone now.
Thank you so much, Doctor. And Dr. Maldonado, you've studied how diseases like measles and polio can resurface when vaccination rates decline. And so from your experience at the Advisory Committee, how dangerous is it when political interference weakens confidence in your committee's historic recommendations?
So unfortunately, we've been quite busy with new research now, trying to show people in numbers and statistical analyses what can happen if we lose vaccination coverage in this country and elsewhere. And we just published a paper in April at Stanford colleagues and colleagues from Baylor as well, and Dr. Chu as well, looking at what would happen in the next 5, 10 to 25 years at current vaccination levels or decreasing levels or increasing levels to measles, polio, rubella, which causes really severe congenital malformations, and diphtheria. And we found that over the course of the next 25 years, you would wind up reversing all of those improvements that we've seen in the last 30 years. That is millions of cases of measles and other diseases, as well as deaths, and that we would return to having measles circulating all the time within the next 6 years or so.
Can I ask you, Dr. Campbell, just inform us as to what goes through a parent's mind when they're thinking about vaccinating or not vaccinating from a pediatrician's perspective?
Well, I think nearly all parents in the United States still look to their pediatrician to help them to decide what the right thing is for their child's health, and that includes vaccines. And parents know just how well vaccines work, and that's why the vast, vast majority of children in the United States are vaccinated. It's absolutely confusing to us as pediatricians why we are sitting here in the Senate building talking about something that just does not seem political. It seems like vaccines are just such a slam dunk. There is no, we don't get it really. So pediatricians are very used to day in and day out talking to moms and dads about their babies and vaccines. So we can continue to do that, but and we like informed parents who come to us with good questions. So we have no problems with that, but there is absolutely no reason why it needs to be in a political stage.
Thank you, Senator, and I will now turn it to Senator Chris Van Hollen.
Well, thank you. First, let me thank Senator Blunt Rochester for holding this very well-timed hearing. I heard some others say, and I'm sure others who were here before have said, this is something we're all hearing from our constituents about in real time, and there's a reason for that. It's because their health is being put at risk. And I want to thank all of you for being here at this important time, including two Marylanders, Dr. Campbell and Nguyen. Thank you for being part of the panel. So a lot has been covered. I do want to jump into a couple real-world cases and just understand what's going on, because Secretary Kennedy told the Senate that the vaccine was something everybody could get. Everybody who wanted it could get it, and that, of course, turns out to be a big lie, and we're hearing from our constituents in real time. Over the weekend, my office heard from one constituent seeking to get the COVID-19 booster at his local pharmacy. His wife is pregnant, and he wanted to make sure he and his family are safe. Despite guidance from our state of Maryland, indicating that Maryland should still have access to the vaccine, including at pharmacies without a prescription, he was told they would not provide it to him. The pharmacy even suggested that he could have it if he said he was in one of the specified high-risk conditions. Understandably, he was not comfortable lying, although Secretary Kennedy was obviously very comfortable lying to the American people. None of our constituents should be put in this position. I don't know who's the best, Dr. Campbell or whoever's. This confusion is going rampant. I'm going to read in a moment another note I got from a constituent who is 73 years old, who went to Kaiser, and they told him he couldn't get the COVID vaccine. So what is going on here, and I mean, obviously Secretary Kennedy is creating mass confusion because of his actions.
Yeah,
what do we need?
Thank you.
What needs to happen so that this doesn't keep happening to our constituents?
You're absolutely right, Senator Van Hollen. It is chaos. We typically, people like Dr. Maldonado and Dr. Chu and myself could explain every decision to everyone. We're on top of what's coming next, what will be at the FDA, what will be at ACIP, what's the AAP going to say. It's very difficult for us now. We know what the right recommendations are, but it's difficult for in person to tell people, can they get the vaccine, can they not get the vaccine? I'm one of your constituents. I may be calling you soon because I'm a physician that takes care of a lot of people with COVID-19. I am not eligible to get the COVID-19 vaccine. I don't have a high-risk condition, and I may look older, but I'm not old enough yet. So even healthcare providers who don't have any of those high-risk conditions are not eligible to get the vaccine.
Yeah, look, this is another note I got. This is from somebody who actually lives close to me in my neighborhood. He says, his name is Scott Robinson. He said he could be happy to say this on the record. Good morning, Chris. I went to Kaiser to get my flu and COVID vaccine yesterday. I got the flu shot, but my doctor told me that they had not received the, quote, official, unquote, guidance from the CDC and FDA, so they were withholding the vaccine for now. They did say if it wasn't forthcoming soon, they would rely on the various medical associations for guidance. I thought Kennedy said in the Senate hearing, anyone who wanted to get the vaccine could get it. He lied. What can we do about this? This is his question to me. He's 73 years old. I mean, was there ever supposed to be any question about whether somebody in that age bracket would be able to get the COVID vaccine?
This is a great question. I mean, I think what's happened is that there has just been so much confusion about how to pay for vaccines. It's not confusing to us as vaccine experts who should get the vaccine, but in the United States, the payment for the vaccine is tied to the CDC recommendation. So you need that CDC recommendation. And CDC is not scheduled to meet until next week to discuss recommendations for the fall. But we're already in the fall. There's already a summer surge of COVID. RSV and flu are coming. We don't usually make these decisions while the virus is circulating. We make these decisions 6 months ahead of time. And so at a national level, it is just pure chaos. I was actually meeting with one of my colleagues, and she has been a pediatrician for 30 years and also served on ECIP. And I've been practicing for 20 years and have served on ECIP. And the two of us sat there for an hour and tried to figure out, how do you get a child a COVID vaccine in this country? And we couldn't figure it out.
And I'm wrapping up here. I have a special recent interest in this. I got a really wicked bout of COVID last week. I'm okay now. I am. I've gone through my quarantine period. I missed some votes this week. But as part of that, I went to the CVS pharmacy and to get some related medicine. But right there on their window, it says, I took a picture of it, free flu and COVID vaccines. And then it says below something about their insurance coverage. There are a lot of people driving up to CVS's and other drugstores around the country right now, thinking that they're doing the right thing for themselves and their family and getting turned away because Secretary Kennedy lied. And I just think people, number one, need to know about the lie. They also need to know that lie is putting people at risk all over the country. And I want to thank again Senator Blunt Rochester for bringing us together, and thank all of you.
Thank you, Senator Van Hollen. I have been trying to keep a tight ship with the questions, but I was so shocked by, again, some of the answers. Like the thought that even medical providers who are going to be treating people with COVID aren't eligible for a COVID vaccine. Unbelievable. Unbelievable. I'm now going to turn it to, I'm bookending Maryland here. I will now turn it to the great senator from the state of Maryland, Angela Alsobrooks.
Well, thank you so much. First of all, to Senator Blunt Rochester, thank you for hosting today's hearing. I think the turnout here and the support shows the need for a hearing like this one. To all the panelists, thank you so much for sharing today with us, and want to thank my colleagues as well. You know, I think it's sad and unfortunate that we're here today discussing this topic because in my mind, it was foreseeable that we would be here. I think many of us could have predicted from day one that we would have ended up here based on the responses that we got from Secretary Kennedy many months ago. Yet here we are, and the damage has already been done, the chaos, the increased costs that we will experience, as well as the corruption that we're seeing, I think will make a mark on our country that will be distinguishable for generations to come, really. It's very frightening. I have, in spite of all that we predicted, here we are this summer watching these efforts to roll back these vaccinations that are needed for so many. And I released just last week, I've been trying to sound this alarm now for months, and released just last week a report that delineates over 203 different actions taken by Secretary Kennedy, one for almost every day he's been there, that harm the health and well-being of the American people. Actions designed to stoke fear, spread conspiracy theories, stack advisory committees with anti-vax cronies, and reduce over-the-counter availability for vaccines. So the sheer number of ways that he has undermined the public health system in our country is overwhelming for everyday Americans. And, you know, we see the chaos and confusion from it every day. I'm pleased to have at least two of my constituents who are here today, super lucky, and Maryland is, as you know, the proud home to so many scientists, researchers, doctors, and others who are providing so much. Just a couple of questions. Ms. Nguyen, just start with you. I know that one of your 3 children has respiratory symptoms that make avoiding infection important. And I wonder if you just might be able to share with everyone what it means as a parent to now have to fight through additional hurdles to get your family members vaccinated.
So one, I'm thankful that we live in the state of Maryland, because I know that Governor Westmore went to a great length to legislate that COVID vaccinations would still be available based on the ACIP guidelines in December of last year. So I'm very grateful for that, because that protects children and our ability and families' ability in Maryland to access COVID vaccinations, and I think that would also include perhaps the regular childhood vaccinations. So that's great for me. However, if I lived in a different state, that would be problematic. For instance, my child has asthma-like symptoms. He's not formally been diagnosed with asthma. He is an X24-week preemie. So he required ventilation when he was young, as well as oxygen support. He came home on oxygen. He was able to be weaned off oxygen, and we no longer had to see a pulmonologist, I think, after his first year. However, when he has a very bad cold, he has asthma-like symptoms. He has wheezing. He has a cough that just is a racking cough. And he has trouble breathing. And our pediatrician prescribes asthma medications, albuterol and budesonide, to help in those situations, to help with the inflammation, as well as help ease the symptoms. And it helps with his cold. Since he's not been formally diagnosed, though, with that condition, he's not being seen by a pulmonologist. If I live somewhere else, he's 6, would he be considered somebody who has an underlying condition? Would I need to get a referral from my primary care pediatrician to see a pulmonologist? What would be how long of a process would that be to obtain a diagnosis? And in the meantime, how many colds would he have? And how prone could he be to infection as well?
Yeah, so I just want to ask, also see my time going, Dr. Campbell. We've seen that some states, including Maryland, have joined forces or taken new clarifying actions to preserve access to vaccines amid CDC turmoil, yet pharmacies, and we've heard a lot of this today, are turning away. And so because of RFK Jr.'s restrictions, have made it so that healthy children and families getting the vaccine are now considered off-label use. And so I wonder if you can just speak quickly to the expanded definition of off-label use and what it will mean for vulnerable populations, and how it will create additional barriers for Marylanders and others in accessing the vaccine.
Thank you, Senator. Yeah, for those who don't know, off-label means when either a drug or a vaccine is licensed by the Food and Drug Administration, it has indications. And if you use it for something other than those indications, it's considered off-label. And we as physicians often prescribe things off-label. The FDA, really for the first time now with COVID vaccines, is licensing them only for people with an underlying condition or for elderly. So typically those recommendation type information comes from the ACIP and the CDC, not from the FDA. The FDA does the licensure and indicates it for prevention of COVID. And then the experts like Dr. Chu and Maldonado on the ACIP would say, well, who is it right for? Who should we recommend it for? But now the FDA is getting in the business of making recommendations. Once it's off-label, in many places, pharmacists will refuse to give it without a prescription. Physicians can still prescribe things off-label, but when it's indicated or on the label, then pharmacists will give it. So it'll make the access much more difficult if the vaccines are provided only off-label.
Thank you so much. Thank you.
Thank you so much, Senator. And I will now, we went Maryland, we will go Delaware. I get to introduce the senior senator from the great state of Delaware, Senator Chris Coons.
Thank you. Thank you to my friend and colleague, Senator Lisa Blunt Rochester, for convening this. Thank you to our wonderful witnesses today for your dedication to public health, to making our country safer, healthier, and stronger, and for your service and your testimony here today. My offices in both Delaware and here in Washington have gotten loads of calls from Delawareans nearly every week since Senator Kennedy was confirmed, Secretary Kennedy was confirmed. Forgive me, I've done that before. My offices in D.C. and Delaware have received calls from Delawareans every week since Secretary Kennedy was confirmed, expressing their concerns, their confusion about what vaccines they're actually entitled to get. And to follow on the point Dr. Campbell just made, literally earlier today, a Delawarean called my Dover office after trying to get his COVID booster at Walmart and being told no one under 65 is allowed to get it, despite Secretary Kennedy testifying to the Senate that anyone who wants it can get it. There are real consequences to his decisions, to the ways in which he is pushing against science and against public health. So if I could, to Denise, as someone who is so grateful for your decades of service to the children and families of Delaware, you've worked in schools for 3 decades. And as a school nurse, you don't just provide care, you also provide security and confidence to kids and their parents. President Trump and Secretary Kennedy are genuinely threatening that security and that confidence by gutting Medicaid, one of the largest sources of funding for K through 12 schools, cutting food assistance so there will be more hungry children in schools, threatening access to proven public health tools like vaccines. Denise, what are you hearing from Delaware's families as they come back to school amid the highest national rates of measles since it was eliminated 20 years ago? Are they feeling secure? Do they have questions? Do they have concerns? What are the families you serve and their children bringing to you?
Thank you, Senator Coons. That's a good question. You had said our dedication to public health, and that's what started school nursing. We started in the early 1900s going around to homes and teaching families how to prevent spreadable illness by washing hands and washing food and stuff like that before you eat. Early in my years of school nursing, we had the H1N1 flu that went around, and we had public health come to our school, and kids were lined up going across our stage, getting their vaccines. I worry that if an outbreak of something like the measles or some other vaccine-preventable disease comes across us, and we have to make a push like we did with H1N1 for vaccines to be delivered to our students quickly and safely and effectively, that there will be a lot of questions and a lot of hesitation for parents to consent to something that has been a successful program for a century. The vaccine program is so successful, and school nurses have been so successful in enforcing that to start school, that you need to have your vaccines. And pediatricians have been so successful at providing those vaccines and educating the parents that people don't know what chickenpox or the measles looks like. I would hate to see for that to change.
And so for students, children who come to school who might be immunocompromised, they're going through cancer treatment or they have a chronic illness, what does it mean if we no longer require vaccination for some of these deadly childhood diseases, measles, mumps, rubella, whooping cough, chicken pox? What are the consequences?
They're devastating, potentially devastating for these poor kids. I mentioned earlier that in public school, every child is entitled to a public school education. So we get everybody, no matter what their health history is. And I would say during COVID, we had parents who were unwilling or unable to send their kids to school because of the COVID epidemic. And they were afraid that their child would get COVID and possibly die from that. And I think that's exactly what you would see with any infectious disease that would go around that is absolutely safely preventable with a vaccine.
One other question, if I might. Thank you. Dr. Maldonado, I have followed closely some of the promising mRNA developments. Pancreatic cancer is a horrible disease. It took my father, my uncle, my pastor, some personal friends of mine, as well as some national figures. And I was hopeful that pancreatic and other cancers might well be targets of new mRNA vaccine research. How might the chaos at HHS and ACIP impact the development of that next generation of cutting-edge cures and treatments?
Well, first, that's a great question. Thank you, Senator Coons. So mRNA technology has been around for at least 30 years now, and it's been well studied. We certainly have gone through an unintended experiment, if you will, because we had to vaccinate people. Millions of people received mRNA vaccines, and they're safe and healthy. They were highly effective vaccines. We know this technology is astoundingly specific and easy to use and can very easily be translated into other uses, for example, cancer, diabetes, other chronic diseases, so pancreatic cancer, as you mentioned. And the fact that there's two downstream consequences. The first is stopping the research in its tracks. Now, it will go on outside of the U.S. for sure. We're going to lose ground. We're not going to be able to make those vaccines here in the United States. And we can't just start up these giant plants overnight. It takes time to build them. There's a $100 to $300 million investment per vaccine to get it off the ground. Probably wouldn't take that long to do that for mRNA because it's so easy to use, but you still need to build the plants, get the facilities going. We're going to lose all that time, number one. Number two, putting the fear and doubt about mRNA, even if we had them right now, is becoming a real problem. We know these vaccines are safe. They have been proven over and over again, and we continue to see this misinformation and disinformation that's being spouted about these vaccines, which are absolutely not true, including from Senator Kennedy's colleague, Dr. Malone, who did peripherally work with the mRNA early on. And so that, even if these might be available, we are worried that people would then not take them seriously or be concerned about their safety when in fact they have been shown to be very safe.
And you thought early stage research on cancer applications of mRNA were promising?
Yes, so the early data coming from the companies that were making these vaccines, the vaccines who were Moderna, for example, and others, the early data were very promising, but now they're stopped in their tracks here, at least in the U.S. So we'll see what happens outside the U.S., but we will lose that advantage in this country, for sure.
Sounds to me like a tragic waste of an opportunity to help advance the boundaries of science, treatments, and cures with American invented and manufactured treatments and cures.
Absolutely.
Well, thank you both. Thank you for your testimony, and thank you, Lisa, colleague, Senator Blunt Rochester, for having convened this today.
Thank you so much. Thank you, Senator Coons, for your great questions and also for your leadership. I want to thank all of you for participating in this Spotlight Forum. You know, initially, the thought was just having the conversation with members of the ACIP and talking to doctors, pediatricians, others who, in the very beginning of Secretary Kennedy's shying away and not real confidence in ACIP, and For me, part of this spotlight hearing was to help people understand just how important ACIP is, just who sits on it. Dr. Campbell, even when you mentioned the fact that you all, when you serve on these different capacities, you're doing it as volunteers. You're doing your everyday work and you're caring about the American people. And so number one was just to make sure we highlight that the 17 people who were just unjustly, summarily told that to go home, really were doing a service to this country. Secondly, we wanted to provide information and put some things on the record. This is also about setting the record straight, but it's also about our real role of oversight. Part of this is about putting things on the record, that we don't want to go back to this billboard here with 500 million cases of illnesses or deaths, and so we wanted to do that. And then I think the other thing, we heard a lot of C's: chaos, confusion, costs, corruption. We initially wanted to have this forum in the fall to talk about children who are going to be impacted, children like Andrew, grandchildren like my Lennox. And so for me, I am grateful, but I think it just makes us redouble our efforts right now, because we needed to shine this spotlight, and now we need to make sure that we go to work for the generations to come and also for our seniors. I thank you again for being a part of this spotlight hearing, and I look forward to the work that is yet to be done to make sure that we are protected during this time and prepared for the future. Thank you, and this meeting is adjourned.